Here's a headline that should make every pulmonologist in the room sit up. Regeneron and Sanofi just ran two nearly identical phase 3 trials of their COPD drug itepekimab and got two completely different answers. One trial worked, the other one didn't. And both of them just got presented, back to back, as late-breaking data at the American Thoracic Society's 2026 conference. Itepekimab is a fully human monoclonal antibody built by Regeneron and Sanofi that blocks a signaling protein called interleukin-33, or IL-33, which is thought to drive airway inflammation in COPD. The twin trials, called AERIFY-1 and AERIFY-2, both enrolled former smokers between the ages of 40 and 85 with physician-diagnosed COPD, moderate to severe airflow limitation, and a recent history of exacerbations despite already being on dual or triple inhaler therapy. Patients in both trials got itepekimab added on top of their existing inhalers, either every 2 weeks or every 4 weeks, compared against placebo. In AERIFY-1, itepekimab worked, and it worked convincingly. The every 2-week dosing regimen cut moderate or severe COPD exacerbations by 27.1% compared with placebo, and the every 4-week regimen cut exacerbations by 20.5%. Both results were statistically significant, meaning Regeneron and Sanofi had a real, clean win on their primary endpoint. Then came AERIFY-2, running at the same time, in essentially the same type of patient. And it just did not replicate. The every 2-week regimen reduced exacerbations by only 1.6%, and the every 4-week regimen by 12.4%, and neither of those numbers reached statistical significance. In plain terms, in the second trial, itepekimab looked barely different from placebo. For pulmonologists, this split decision matters for more than academic reasons. Regulators generally want to see a therapy work in more than one adequate, well-controlled trial before they'll approve it, and having one clear win sitting right next to one clear miss, in what was designed to be a matched pair of trials, is exactly the kind of result that creates real doubt about whether itepekimab has a straightforward path to FDA approval in COPD. Both Regeneron and Sanofi will now have to figure out how to explain why the same drug, in the same dosing regimens, in a similar patient population, produced such different outcomes. There's also a detail worth flagging for anyone treating COPD day-to-day. Itepekimab was tested exclusively in former smokers, not current smokers, by design. That restriction traces back to earlier phase 2 data on itepekimab, which showed the drug's benefit was concentrated almost entirely in patients who had already quit smoking, with little to no signal in people who were still smoking. So even in AERIFY-1's best-case scenario, itepekimab is being positioned as a drug for one specific slice of the COPD population, people who already quit, who are still having exacerbations despite standard inhaler therapy. Where this goes next is genuinely uncertain. Regeneron and Sanofi will have to decide whether to run additional confirmatory studies of itepekimab, lean heavily on the strength of AERIFY-1's data alone, or reassess how they define the patients most likely to respond before trying again with regulators. Either way, AERIFY-1 and AERIFY-2 just handed pulmonologists a real-world lesson in how unpredictable IL-33 biology can be, even inside two trials that were built to look almost exactly alike. That is the story of Regeneron and Sanofi's itepekimab AERIFY-1 versus AERIFY-2 mixed phase 3 COPT results at ATS 2026. Add your perspective in the comments, share this story with a colleague, and subscribe for the next ConferenceHype narrative.